let's talk about red light. There's red light and there's near infrared light therapy. Okay, so these are the most frequently used types of devices, and they're really for photobiomodulation. Okay, and this is a science-backed method using specific light wavelengths to activate healing in different tissues. This helps to reduce inflammation and also stimulates mitochondria activity, which then energizes your cells, which then energizes you. Okay, so different wavelengths penetrate at various depths. Okay, so depending on the wavelength of the light spectrum that you're using, okay, there's different depths that wavelength will reach. Okay, some are good for skin repair and skin healing and anti-aging, just looking more beautiful, right? Others are good for joint therapies in arthritis and for joint issues, injuries to the joints even. Some are good for brain health. All of you diabetics out there, capillary circulation is what brings on neuropathy. Okay, so poor capillary circulation is where neuropathy comes from. Okay, that's why the nerve endings are dying in your feet or your hands. Okay, it's because that capillary circulation isn't open. Okay, the blood can't get there. All right, red light at the 630 wavelength opens up those capillaries, helping the capillary blood flow. Amazing stuff. What's really cool is this frequency works really well with the near infrared 810, 850 wavelengths. Okay, let's jump into those real quick. Let's talk about near infrared spectrum. Okay, near infrared spectrum starts at the 810 nanometers. Okay, and let's see here. With that, there's all kinds of things that it can really help, because this doesn't penetrate in the millimeter range, it penetrates in the centimeter range. So those of you that are familiar with centimeters, you understand what I'm talking about. Those of you that are used to more like the American standard where we're talking inches, okay, it's 2.5 centimeters make 1 inch. Okay, so with the 810 wavelength, we're going several centimeters, maybe 2 to 3 inches into muscle, bone, and even the brain. Okay, so the 810 wavelength crosses the skull. It can penetrate the skull and is neuroprotective, meaning it protects those neurons in the brain, keeps them from being harmed. But it also is great for cognitive support. Okay, so just a quick plug. All right, we have in the list of products that are available here, there is a cap with this type of lights in it. Okay, this type of red light therapy in it, and this is the kind of thing that type of device will help with. Okay, so it crosses the skull, goes into the brain, and helps protect the brain and improve cognitive function. This reduces brain fog, improves your mood, and also helps settle neuroinflammation. So places that I would use this in a clinical setting would be people with autism, people with cerebral palsy, people that have had strokes. Okay, these are the types of things I would use that cap for, okay, in a clinical setting. So this enhances circulation and oxygen delivery, okay, deep into those tissues. Remember, we're talking 2 or 3 inches, or maybe 8 to 10 centimeters, where this is penetrating really deep. Okay, this accelerates muscle and joint recovery as well. A really cool thing about this particular frequency is it also activates stem cells. Okay, so wherever you're applying this 810 frequency in your body, you're activating stem cells in that local area. Really cool stuff. Great adjunct. So clinically, I would use this in conjunction with prolotherapy or ozone therapy or prolozone therapy or PRP treatments. Okay, where we would treat the area with this type of frequency, the 810 frequency, before doing the prolotherapy, the prolozone or PRP treatments. Okay, cool stuff. It really maximizes the activation of stem cells in the area. Let's move on to the 830 wavelength. Okay, this is near infrared light. Okay, and this penetrates even deeper. Okay, this goes deeper into the system. This is great for deep tissues like ligaments. Okay, ligaments like at the end of the bone, right? Cartilage also at the end of the bone. For bone healing, like if you've broken a bone, or let's say you have osteoporosis, okay, you want to strengthen those bones. This is the type of light you want to use to do that. Okay, so this is real strong for deep musculoskeletal repair. Okay, so sports injuries, you fell off a ladder, you got in a car accident. Okay, those types of injuries, this is the winner. Okay, this is the pay dirt, like they say here in Idaho. Okay, this is a good one for injuries. Okay, so if you've had a musculoskeletal injury of some sort, maybe you slipped a disc, maybe you pulled a muscle, maybe you sprained an ankle or something like that, this is the type of red light that you'd want to use on that type of injury, because it speeds up the recovery from those types of things, speeds up musculoskeletal repair. Another thing that this can be used for is dental issues. How many people out there have receding gums? Or maybe you have cavities, or maybe you've had a lot of gingivitis or periodontal disease. Okay, this is the type of red light that would be very beneficial for your teeth, your mouth, your gums. Okay, and it also, let's say you broke your hip, or you broke an arm, or you broke a leg, or you broke a rib. Okay, I've been in martial arts for a long time. I've had most of my ribs broke. Okay, when I was early on in doing a lot more full contact stuff, I wish I had this kind of thing around back then. They didn't know this back when I was doing that. So, it would have been nice to get some bone healing. I had one time I broke 4 ribs, and then as I was healing from that, I got bronchitis. I was in my early 20s, and oh my gosh, that was so painful. So the 830 wavelength is also excellent for skin and deep wound healing. Okay, so let's say you've had an abdominal surgery, okay, or reconstructive surgery of some sort, and there's a thing that forms. It's called a keloid. Okay, this type of wavelength helps to reduce that buildup of scar tissue. Okay, so even if it's old scar tissue, the laparoscopic surgeries they can do today didn't exist. Okay, and I've had people over the years, gosh, I think off the top of my head, I had one patient who had her gallbladder out. The scar went from her xiphoid process to the floating ribs on her right side. It was a scar. It was probably 8 to 10 inch long, maybe 25 centimeter long scar. Okay. And in 30 years, it never completely healed. It took me 6 acupuncture treatments with microcurrent to get that scar to heal up. We reduced the scar tissue buildup by about 80%. Okay. But we didn't have these types of devices back then. Had I had this type of device, I probably could have eliminated 90% or more of that scar tissue in a lot fewer treatments. So this is pretty amazing stuff. The 830 wavelength is also excellent for joint and connective tissue inflammation, so arthritis, even rheumatoid type arthritis. Okay. This is also excellent for nerve repair. Okay. Remember, I was talking earlier about that microvascular circulation. Okay. That capillary circulation for neuropathy. Well, remember that those frequencies go really well with these frequencies if you combine them, like the products that Mr. Otto is supplying people with. Okay. That's how these things are designed. And so this 830 wavelength frequency is excellent for neuropathy, for strokes, for mini strokes even. Okay, things like that. Very, very helpful. It speeds up the recovery of those things, speeds up nerve repair.